All right, you're welcome. This is Celebrity Pharmacologist, and today let's look at amlodipine versus nifedipine in after brief lectures on hypertension and antihypertensive. So today we'll be selecting few antihypertensives, that's few drugs used in management of hypertension. We'll be taking drugs like amlodipine, nifedipine, uh, verapamil, captopril, lisinopril, valsartan, telmisartan, and so many others. Now let's dive into this amlodipine versus nifedipine. First thing first, by way of classification, they are classified under the antihypertensive called the calcium channel blockers. Calcium channel blockers, which is also known as CCBs. And under this classification, it is called, they are called, I'm talking about amlodipine and nifedipine, they are called the dihydropyridine calcium channel blockers. Dihydropyridine calcium channel blockers. They are very, very potent. They are very, very potent. We're talking about amlodipine and nifedipine. Now let's talk about their mechanism of action. They have the same mechanism of action. They block the L type of calcium channels in vascular smooth muscle. What this means is that calcium is actually present in most smooth muscles, of which they cause what we call vasoconstriction. And know that when there is vasoconstriction, it will lead to it will increase the peripheral vascular resistance, thereby increasing blood pressure. Let me explain this. This is the only mechanism of action I'm going to explain. Let me explain this with a paper. Let me use a paper to explain this. This is a sheet of paper, and let's assume that this sheet of paper it's is the blood vessel. So let's assume this sheet of paper is a blood vessel, and my mouth, my mouth is the heart. My mouth is the heart, and the air I'm going to pump out, the air I'm going to pump into this vessel is the blood. Now, for instance, let me explain this. I'm going to explain this in a Nigerian way, a layman language. So, if you are not in Nigeria or you don't understand some Nigerian language, please, you can just forward it to where we start talking about others. But in Nigeria, now let's say this is the I said like my mouth is the heart, is the heart. This is the blood vessel, and the air is the blood. So, for instance, now this blood vessel sends blood to the hand. Let's assume it send blood to the hand. Now the heart is supposed to pump the blood. You see, small pressure is sending it very well. That is it. But when calcium now causes what we call vasoconstriction, what's constriction? Constriction simply means to contract. So it will now cause the vessel to be tinier. If a vessel is something like this, but when there is constriction, the upper one will come, the lower one will come, they will now become very tiny, reduce. So making it difficult or harder for blood vessels to pass through. You see, making it harder for blood vessels to pass through. Now understand this concept. Now, if I should put air through this vessel, you see it goes easily. But when there is constriction, that means it contracts. Then what you see is that it will block, like it's going to close a little bit. So even if I put the air now, it still goes, but I need more pressure. Now, assuming this air we are sending goes to the hand is it doesn't it's not it does there's no sympathy. It will not be compassionate to say the blood that they are sending to me is small or it's too small. Let me manage. It's not going to manage. It will still send signal immediately when there is shortage of blood to some tissues or to some part of the body. It will send signal to the brain, maybe through pain. Say, please, the brain, please, we need blood. So the brain on its own will then send signal to that same heart, pump blood to this part of the body. Now immediately the heart will say, okay, yes, sir. We try to pump this blood. The same pressure, the heart will then start to work fast, starts to work harder to make sure that blood gets to that part of the body. So automatically you are putting this calcium will then put the heart into harder job to it cause what we call increase in pressure, because there's what we call peripheral, there's increase in peripheral resistance, peripheral vascular resistance, and there's what we call vasoconstriction. So what amlodipine will do, is to stop this calcium from, it will block this calcium in the vascular smooth muscle, in the vascular, in the vessel smooth muscle. And when this thing happens, there will be increase, there will be dilation. So when there is dilation, it will reduce peripheral vascular resistance, and automatically the blood pressure will reduce, the pressure needed. Like it will then, like what I'm saying here, it will cause dilation. The dilation means it will open up. Your hand will, from constriction, it will release itself. So the blood can go freely, no more pressure. So that's just the mechanism of action. That's what calcium is doing there, and that's why we have calcium channel blockers.